Hello and welcome. Today we're diving deep into a topic that touches the lives of millions of men across the world, Tadalafil. You may have heard about it from friends, from a doctor, or perhaps in passing through commercials, but what most men really know about this medication is often wrapped up in myths, half-truths, and uncertainty. Some are curious about it, some are using it, and others are hesitant because of fear or stigma. Our goal today is to strip away that confusion and deliver a clear fact-based understanding of what Tadalafil truly is, how it works inside your body, the different ways it can be used, and why it has been a game changer for men's health. By the end of this conversation, you'll walk away with a complete understanding that will help you make informed choices with confidence. Let's begin by setting the stage. Why is this medication so important? The answer lies in the prevalence of erectile dysfunction, or for too long, men have associated ED with weakness, shame, or even failure, but the reality is completely different. Erectile dysfunction is not a reflection of manhood. It is a common medical condition with clear physiological causes. In fact, studies show that nearly 50% of men over the age of 50 will experience some degree of ED. That number rises as the years go by, but what surprises many is that it is not just an older man's problem. Younger men are also affected, with some research suggesting that up to 30% of the general male population will deal with erectile difficulties at some point in their lives. The reasons vary, ranging from high blood pressure, diabetes, heart disease, and obesity, to psychological causes like stress or depression, and of course the natural changes that come with aging. What matters most is that this is not a personal failure. It is a health issue, just like high cholesterol or back pain, and it deserves to be addressed with the same seriousness and compassion. And this is precisely where Tadalafil comes in. So how does this medication really work? This is where much of the misunderstanding lies. Many people imagine that taking a pill like Tadalafil will magically produce an instant erection, almost like flipping a switch, but that's not how it works at all. Tadalafil doesn't create an erection out of thin air. What it does is much more subtle and far more elegant. You still need to be sexually aroused for it to have any effect. In your body, there are natural processes that signal the start of an erection and natural processes that signal its end. Tadalafil works by temporarily blocking the main enzyme that tells the body to end an erection. In technical terms, it is what doctors call a PDE5 inhibitor. Think of it like this. Your arousal is the switch that turns the light on. Tadalafil doesn't flip that switch for you. But once you flip it, the medication essentially helps hold the switch in the on position, keeping the system stable and responsive. This makes it easier to achieve and maintain an erection that is firm enough for satisfying sexual activity. It is not artificial, it is an enhancement of the body's natural response. This is the key point that men often miss. Without desire and stimulation, nothing happens. Tadalafil only assists what your body is already trying to do. Now, one of the unique advantages of Tadalafil, and what makes it different from some other medications in its class, is that there are two main ways to use it, two approaches that fit very different lifestyles and preferences. The first is what's called the on-demand method. This is the approach most people think of when they picture ED medication. You take a higher dose, usually 10 or 20 milligrams, a couple of hours before you expect to be sexually active. The standout feature here is its duration. While some similar medications last for a much shorter window, Tadalafil's effects can last up to 36 hours, which is why it earned the nickname the weekend pill. That means you could take it on a Friday evening and still feel its benefits on Sunday afternoon. For men who prefer the flexibility of planning ahead and having a wide window of opportunity, this option can feel liberating. The main drawback is that it does still require a certain level of planning. You have to think ahead, anticipate intimacy, and align your dosing schedule with your plans, which for some couples can sometimes create a sense of pressure. That brings us to the second method, which has become increasingly popular over the past several years: daily use. With this method, the dosage is much lower, typically just 5 milligrams taken once per day at the same time. Almost like you would with a vitamin. What this does is maintain a steady level of the medication in your bloodstream. The result is that you are essentially ready whenever the moment feels right, without needing to plan or wait for a pill to kick in. For many men, this daily routine restores not only sexual function, but also the spontaneity and natural rhythm of intimacy. There's no need to schedule sex around a dose, no sense of racing the clock. You can be present, responsive, and relaxed, which can reduce performance anxiety and strengthen emotional connection with your partner. This is about more than just mechanics. It's about restoring confidence and joy to a part of life that should feel natural and unforced. An added bonus is that the daily 5 milligram dose is also officially approved to treat benign prostatic hyperplasia, or BPH, which is the medical term for an enlarged prostate. This is a condition that becomes increasingly common as men age, causing urinary symptoms like frequent trips to the bathroom, urgency, or difficulty starting and stopping urination. For some men, one low daily dose of tadalafil addresses both ED and prostate symptoms simultaneously, improving quality of life in more ways than one. But with popularity come myths, and there are 3 in particular that create the most confusion and unnecessary worry. Myth number 1 is that tadalafil is addictive. This is false. Tadalafil is not physically addictive. It does not cause chemical cravings or withdrawal symptoms the way substances like nicotine or opioids do. However, what some men experience, especially those who use it recreationally without needing it, is psychological dependence. They begin to associate peak performance only with the medication, and over time they may convince themselves they can't perform without it. That's a mindset issue, not a biological addiction. For men with genuine medical need, using tadalafil is not a crutch, it is a treatment. Myth number 2 is the belief that the body builds tolerance and the drug stops working over time. This is another misconception. The way tadalafil works doesn't change, and the body doesn't become resistant to it. What does change is the underlying condition. If the root cause of ED is related to circulation, diabetes, or progressive vascular disease, then those conditions can worsen with age, making it seem like the pill has lost its power. But the truth is, it is not the pill weakening, it is the condition progressing. That distinction matters. Myth number 3 is perhaps the most common and most frightening, the idea that tadalafil is dangerous for the heart. This concern goes back decades to when ED medications were first introduced and widely misunderstood. The reality is that for most men, tadalafil is safe for the heart, and in fact, because it widens blood vessels, it slightly lowers blood pressure. The one absolute exception is men who are taking nitrates, medications commonly prescribed for chest pain or angina. Combining a nitrate with tadalafil can cause blood pressure to drop to dangerously low levels, which can be life-threatening. This is why it is always emphasized that you must never take the two together. Outside of that scenario, the fear of tadalafil itself being inherently dangerous to the heart is a myth. Of course, no medication comes without the possibility of side effects, and understanding these helps men make calm, informed decisions instead of panicked ones. Because tadalafil works by dilating blood vessels, it can widen them in places beyond the penis. This explains the most common side effects. When blood vessels in the head widen, some men experience headaches. When those in the face dilate, there may be flushing or a warm sensation. If it happens in the nasal passages, it can feel like congestion or a stuffy nose. Some men report back pain or muscle aches as well. The important point to understand is that these effects are generally mild, temporary, and often fade as the body adjusts, especially with the low daily dose. For many, side effects disappear entirely within the first week or 2. This means that for most men, the trade-off between mild side effects and restored sexual function is well worth it. Now, while tadalafil is a well-researched medical solution that has improved the lives of millions, some men are naturally interested in exploring natural approaches that avoid medication altogether. There are lifestyle changes, like improving cardiovascular health, losing weight, managing stress, and addressing hormone levels that can dramatically improve erectile function without any pills. At the same time, it's worth acknowledging that for those who want results here and now, tadalafil offers reliability and reassurance that lifestyle adjustments alone may not provide. Whether you prefer medical or natural paths, the key is to be informed and intentional. So how can men get the best results from tadalafil? Timing matters for the on-demand dose. While some feel it working in as little as 30 minutes, giving it about 2 full hours allows the medication to reach peak concentration in the bloodstream. That's when the effect is strongest. Another advantage of tadalafil compared to certain alternatives is that it is not significantly affected by food. You don't have to take it on an empty stomach or worry about a heavy meal blocking its effect. Moderate alcohol consumption is also generally safe and doesn't interfere with the medication, though of course excessive drinking can itself contribute to ED. Finally, if a man finds he isn't getting the results he wants, the solution is not to give up after 1 or 2 attempts. Factors like dosage, timing, low testosterone, stress, or performance anxiety can all play a role. This is why an open and ongoing conversation with a healthcare provider is essential. Fine-tuning the plan, adjusting the dose, or addressing psychological factors can often turn frustration into success. When we step back and look at the big picture, the message is clear. Tadalafil is not a miracle, but it is a remarkably effective and safe treatment when used correctly. It is not addictive. The body doesn't build tolerance to it, and for the majority of men, it is safe for the heart as long as nitrates are avoided. Whether you choose the on-demand dose with its long weekend window, or the daily low dose with its constant readiness and extra prostate benefits, Tadalafil is more than a pill. It is a tool for restoring confidence, intimacy, and quality of life. And that's the ultimate goal, not just physical performance, but a fuller, happier, and more connected life. If this conversation has given you clarity and peace of mind, then it has done its job. Thank you for listening, and remember, informed choices are empowered choices.